I can trust this woman. This is my first time meeting her and she expects me to spill all my secrets? No way. I can't tell her the truth. She'll just judge me for it.
Hi Laura, my name is Nurse Amanda Hannigan and I am a psychiatric nurse practitioner. So why are you here today?
My parents told me you were a therapist and you'd help with my anxiety or whatever.
So I have a nursing license as opposed to a doctorate like a psychiatrist would have, but we perform a lot of the same services. I can even prescribe medicine if that is something that you would like to try. But therapist is more of a general term for nurse practitioners, psychiatrists, and sometimes social workers as well.
Oh, I didn't know that.
Oh, that's okay. Not a lot of people do. So I am here to help you not only with any anxiety, but also to understand kind of what therapy is as well. So have you ever had therapy before?
No, never, but I have friends that go to therapy a lot.
Well, it's going to take me more than just one session to kind of learn your story and what works best for you. So is it alright if we just jump right in?
Yeah.
Okay. So what are you hoping to get out of therapy?
I've just been feeling off lately and I just want to feel normal again.
Well, let's start making your treatment plan for your general anxiety. And after that, we'll try different methods of self-care outside of talk therapy to just get you going.
These past 2 weeks, I've liked some of the practices you've given me, but I still don't feel like I'm better. I mean, like, just last week I started crying out of nowhere.
I'm glad that you have been enjoying some of the self-care practices, but you know, it takes a lot of work, and mental health is just like physical health. You have to keep working at it, and there might not be a moment when you feel that you are better, but it's about upkeep.
But one day I'll stop feeling anxious or whatever, right?
Well, your diagnosis is generalized anxiety disorder. So, like I said, there's not necessarily a day when you're going to say, I'm cured. But if you work on managing how you're feeling and grounding, those symptoms that you're feeling can definitely ease up over time and help you continue to feel better.
You mean I'm gonna be like this for the rest of my life? That sucks. I thought you were gonna cure it.
You're not the only one who's feeling like this. You know, do you know that 1 out of 6 young people has some kind of mental health disorder, and about half of those never get treatment? So you're already on the right track. The first step is just kind of experimenting and seeing what works for you.
But what if I never even feel like I can manage my symptoms?
Then we just keep trying different methods. You know, we can keep doing cognitive behavioral therapy. There are workbooks. You can keep doing the self-care exercises that you've been doing. You know, there are alternative medicine options, like you could try herbal teas or acupuncture, or even we can try medicine if that's something you feel like you want to try. We just have to keep trying to figure out what your goals are and see what works. So it looks like we're just about out of time for today, but do you want to meet next week, same time?
Yeah. I think it's best if I don't give up on myself.
Hi, and welcome back to Interview with an Expert. I'm here today with Monica Morris.
Thanks, Layla. Appreciate it. My name is Monica, and I'm a licensed clinical social worker.
So Monica, why did you become interested in this profession?
I think the reason a lot of people become interested in psychology is either we have experience with mental health issues in the past, or we see the effects of it in some place in our lives and we become interested in it. And so I struggled a lot with my mental health, and I thought I could help people and I could be that person that I wish I had when I was your age.
That's a wonderful reason, Monica. As teens, how can we see the signs before going to seek a mental health specialist, or what kind of symptoms should you look for in the case of mental illness?
That's a great question, Layla. Well, I think the number one thing that I look for and the thing that's most important are what is getting in the way of your being a teenager. Are there things, we call them ADLs, activities of daily living. Everybody gets anxious, everybody gets worried, but if you get anxious and worried to the point where you're paralyzed and you can't do anything and you can't make decisions, or you're so sad to the point where you can't even get out of bed, you're not eating, you're sleeping too much or you're sleeping too little, you're not hanging out with your friends, those are times when you're like, wait a minute, that is not typical. It gets to the point that it's so big that it gets in the way of us enjoying our life. When it becomes too much, that's when I think that teenagers should really consider talking to their parents, talking to an adult, and seeking help.
So in the case that someone starts seeing these signs, maybe needs to go talk to somebody, has been suggested to go to a therapist or a counselor, what specific types of mental health specialists are there out there, and how can those people help with different types of mental health issues?
Another awesome question, Layla. There are many different types of therapists. I'm a licensed clinical social worker, which means I have a master's degree in social work, 2 years post-master's supervision, and I can practice independently. There are also LPCs. LPCs are therapists who have a master's degree in human services, psychology, something besides social work, and also 2 years post-master's supervision. There are psychologists. They mostly do a lot more testing, so if you want like IQ testing or you're worried more about autism, things like that, you would probably go see a psychologist. And then there are psychiatrists. Psychiatrists are medical doctors. Some of them do therapy, but most of them just prescribe medications for depression, anxiety, and things like that.
So of course there are these different types of therapists, and how would a teen be able to access these resources, not just therapists, but general ways to take care of their mental health?
Well, the great thing is that here in Colorado, the law is that if you're 12 years old, you can go and see a therapist without your parents' permission. So a lot of times kids are in abuse situations, unsafe situations where they can't involve their parent. You can go into any mental health community mental health center, hospital, wherever it is that you want to go to seek help. In Denver Public Schools, we have 18 different school-based clinics, and each clinic usually has at least one full-time therapist in your guidance counselors, things like that. In terms of taking care of your mental health, I think it's really important to remember good self-care starts all the time. So try to push yourself to do things that maybe you're enjoying. So if you're really, really depressed and you don't want to get out of bed, I think every morning that you do get out of bed, that you get ready, that you take a shower, that is a victory, and you should like high five yourself for them. Because when you're depressed, it really is those small things that are really hard to do. When you're anxious about something and you're having a panic attack and you're able to calm yourself down and get back into whatever it is that you were doing, those are small victories. But in the meantime, you should always make time to do those things and be around people that make you feel good, that make you happy, that support you in your goals, and that generally care and love you.
So before we kind of wrap things up, are there any other pieces of advice you would give to teens who are maybe worried about their mental health, or worried about a friend, or just want to take better care of themselves?
And I think that's really important. I think the number one thing that I would have teenagers do is I would have them look at the people in their lives and look at who they can trust and who they can talk to. And a lot of times when you're struggling with mental health issues, it feels very isolating, but just know that like lots of people are struggling with that exact same thing, and it's not just you, right? So, lots of people struggle with that, but it does feel very isolating. So find a trusted person that you can talk to. If it's not your parents, an aunt, an uncle, a teacher, your guidance, your counselors at school, anything like that. People that you can talk to, confide in. In terms of your friends, if you're worried about your friend, I always err on the side of telling rather than not, because a lot of times, especially with things like suicide, worried about your friend hurting themselves or doing something, I'd rather have my friend be alive and mad at me than dead and feel guilty that I didn't do anything, right? And as a therapist, I struggle with that too. You know, I want to maintain a good relationship with my clients, but at the same time, if they tell me they want to hurt themselves, I have to report that. And so, and a lot of teenagers struggle with that, but you'll also find that once that is over and once that crisis is over, your friend will come back and they'll thank you. To borrow that phrase, it does get better. It just seems like a lot and it seems like impossible, but it does, it just takes time and it takes work.